Good afternoon. Myself Dr. Gloria Naik, Assistant Professor in Cardiovascular and Respiratory Physiotherapy in D.Y. Patil College of Physiotherapy, Kolhapur. Today we are going to learn about humidification, which is very important topic in cardiorespiratory patients. So we should first understand what is humidification and how to use it as an adjunct of chest physiotherapy to the patients. So what are the objectives? What we are going to learn today, that is define humidification, explain the principles and working of humidification, types of humidifiers, and how does humidifiers is going to be an adjunct to the chest physiotherapy. So all of that we are going to learn in this session. So contents. So what we are going to learn is humidification, the definition of it, indication, principles of humidifier, functioning, types of humidifiers, and it used as adjunct of chest physiotherapy. Now moving on, starting with the humidification. So humidification, it is the process of formation of water vapor or water evaporated in its gaseous form. So in humidification, what we understand, we have heard mostly about the humidity. So what is humidity? That is a water vapor which is contained in the air. Okay, so the process of formation of water vapor is called as humidification, or water vapor which is evaporated is also called as humidification. It is to artificially condition the gas which is introduced into the patients by adding water vapor. So when a patient requires oxygen therapy, we cannot just administer the dry gas, but along with it we need to combine it with the humidifiers. So why is humidifier needed? Now we are learning about humidifications, in which patients is it needed and why is it required, that we need to understand. So before understanding that, we'll learn what is the respiratory system. So our respiratory system is divided into two, that is your upper respiratory tract and your lower respiratory tract. So as you can see in the image, so respiratory system starts from the nose, nasal cavity, down the pharynx and down the larynx until the epiglottis. So this is the upper respiratory tract, and then the lower respiratory tract starts, which is trachea, pulmonary bronchi up to the lungs. So what happens, the humidification things which are required is mostly occurred in the upper respiratory tract. So what are the functions? First we will understand of upper respiratory tract. So what happens in upper respiratory tract is filtration, next is humidification, and it regulates the temperature. So what happens when we inhale the air, some amount of particles, foreign particles also get inhaled along with that. So what happens in the nasal cavity, these particles needs to be filtered out. So upper respiratory tract, the major function is filtration of these foreign particles. Next is humidification. Now what happens when the air which is inhaled is a dry gas, there is no amount of water vapor in that, but what happens as soon as you inhale the gas, what happens, the water vapor which is present in the upper respiratory tract in the form of mucosal, what happens, it absorbs all the dry air and then it gives the moisture which is important for the lower respiratory tract, and then it regulates the temperature. So the air which we are breathing in, what happens in the upper respiratory tract itself, it regulates the temperature same as the body temperature, and then the air which is filtered, which is humidified and regulating temperature, enters the lower respiratory tract. So lower respiratory tract, again it consists of your trachea, bronchi as well as the lungs. So why these all functions is required, that we need to understand. So why it is required? First, to maintain the viscosity of airway secretions. If airway secretions get thicker and thicker, it is very difficult to exhale it out, to excrete it out. Okay, so it is very important to understand or to maintain the viscosity of airway secretions so it can be easily moved out of the body. Okay, then the protection of respiratory tract. The protection is very important because the mucus, which is the line of defense in our body, because what it does, mucus traps all the foreign particles and exhales it out. Okay, then adequate ciliary function. Ciliary function is very important for airway clearance, for removing all kinds of mucosa, then which helps or which aids in the easy mucociliary clearance. Now we understand we need the humidification for the patient, but when and which patient requires that? So what happens, we can easily understand that humidification is required when anything interferes with the function of upper respiratory tract. Just now we have learned about the functions of upper respiratory tract. The humidification occurs in upper respiratory tract. So if anything interferes with the upper respiratory tract function, the humidification function is lost, and that needs to be artificially conditioned. conditioned. Okay, so first how it is delivered to the patient, it is delivered in the form of supplemental gas or supplemental oxygen, which is in the form of dry gas. Next, in the high flow oxygen. Now when we are giving dry gas or high flow oxygen, we cannot just give it in the form of gas, but along with that it should be combined with the humidifier. Okay, and also more than 4 liters of oxygen or 4 liters of oxygen has to be combined with the humidification. And the third one, that is upper airway is bypassed. What happens sometimes when there is intubation done? So what happens, the intubation starts from the mouth and it goes straight, it bypasses the upper respiratory tract. So whatever the functions of upper respiratory tract was there earlier is not there anymore. So for that, artificially we need to condition, artificially we need to give the humidification. And next is to soothe the irritated upper airway. Now what happens when the intubation is done, as the patient gets stable, there needs to be extubation as well. So after the extubation, there can be irritation in the laryngeal area, there can be edema. So this irritation the patient can feel. So because of that, we can give enough amount of humidification in such patients to feel relaxed from such kind of irritations. Also it can be given in post-inhalational anesthesia. Then for the thick consistency of airway secretions, if the airway secretions are very thick, it is very difficult to clear the secretion. So we can give humidifiers or humidification to the patient so that the airway secretions which have become thick can become thin and can easily come out with other chest physiotherapy techniques. Next, what are the methods of humidification? Now there are various methods of humidification, but first we learn about what is the main and natural method of humidification, that is systemic hydration. As we all know, systemic hydration is simply drinking water. So when you drink water, what you do, you hydrate your airways from within, which is very inexpensive method and safe method. So we know how much water to drink every day, which is going to hydrate ourselves from within, which is helping us to clear the secretions consciously or subconsciously. Now, if the person is not able to do it by their own because of some conditions, then what I have to do? We have to give the humidification in a artificial way. So that artificial way, there are two methods by which humidification can be provided to a patient. So it is, one is active humidifiers and next is passive humidifiers. So active humidifiers, we learn about active humidifiers in detail. So active humidifiers can be heated or non-heated, and there are 4 types of active humidifiers. So first one, it is bubble through, and second one is pass over. Now second pass over, it again is divided into 3 types, that is simple reservoir pass over wick and pass over membrane. So we learn about it. The first one, we learn in brief about the bubble through humidifier. So as you can see in the image, what is happening, we have artificial oxygen, commercially used oxygen, which is going to go into the humidifier container. There is going to be a container in which there is fluid or there is water. So what happens, the oxygen, the dry gas is going to get in the container, it is going to mix along with the water, and then it is going to form a bubble. So that bubble, it is going to pick up the moisture and then it is going to give to the patient. So this is called as bubble through humidifier. Now second one, we'll understand these bubble through humidifiers come in different forms. What are the forms which are used in practice? First is bedside. You might have noticed that in hospital settings. Next is home O2 concentrator, which is portable and given at home, or O2 cylinder, which also requires humidification along with the dry gas. So next is pass over humidifiers. As we have learned, there are 3 types, that is simple reservoir, membrane reservoir and wick reservoir. There is only one difference between the bubble and the pass over is, in bubble what was happening, the dry gas which was entering into the container was entering in the water and then bubbles was getting formed. But in this type, that is pass over, the dry gas is just going to pass over the surface of water. It is not going to get dip in the water. It is just going to over the surface of water. So how is the gases going to mix with that? That is heated. Okay, so what happens in passover? You're going to on the heat at the bottom, as you can see in this image. So this area, we are going to heat this area, so that what happens, the water gets, the water forms in water vapor and it gives the humidification to the air, and then you can give it to the patient. And the other 2 types, that is wick, passover wick and passover membrane. So what these are going to do, this is just going to increase the surface area, so there is more time for absorption of the moisture, so that the humidification can be done even better than the simple reservoir. So these are the 3 types of passive pass over humidifiers. Now second one is passive humidifier. In passive humidifier what happens, there is no use of the external oxygen, external commercial oxygen, but in this type what happens, we use the patient's air only to give in the another breath. So it is also called as heat moisture exchanger. In this what happens is it uses the exhaled water vapor and body heat and returns it in the next inhalation. So when a patient is exhaling in the ventilator, what happens, there is a HME device which you can see here. Okay, so what happens when he's exhaling, the water vapor gets trapped in that, and in the next inhalation the water vapor gets mixed along with the dry gas and the humidification is provided. So in active humidifiers you need oxygen from external, and passive humidifiers patients water vapors are only used from exhalation and is again entered into inhalation. So it is mostly used in mechanically ventilated patients. So in passive humidifiers there are two types, as you can see, it is hygroscopic and hydrophobic. Now name itself can tell. In hydroscopic what happens, it absorbs and holds the water, it is absorbent material is used. So when a patient is exhaling, what happens, the water vapor which is coming out will get absorbed in that absorbent substance and absorbent particle, and what happens in the next inhalation, along with that water the dry gas gets humidified and then we can inhale that and the patient inhales it. In hydrophobic, as the word says, phobic is fear and hydro is water. So what happens, the particle or the substance which is placed there is fear, it has fear of water. So what happens when a patient is exhaling, the water vapor and all, it cannot get absorbed in that, but it just stays on the surface, and during the next inhalation, along with that water vapor, the dry gas again gets inhaled, which gets humidified and which is used for the patient. Okay. So now what we have learned for today, first is humidification. What is humidification? It is very important to understand. Humidification is nothing but just adding the water vapor to the dry gas, which is very important and which is the function of upper respiratory tract. Then the indications in which patients we need to use, mainly the respiratory conditions and the critical patients. Then types of humidifiers, as we know there are two types, active and passive humidifiers. So active humidifiers, it use commercially available O2, and in passive humidifiers what it does, it uses the patient's water vapors while exhaling and then give it back again to the patient while the next inhalation. I hope everyone has understood about the humidification, and thank you for the kind attention.